And then add to that the anti-inflammatory effects as well. To me, as an anti-inflammatory agent, even if none of the other things that we talked about work from the perspective of translating the mouse work to humans, the liver, the heart, these types of things that we're seeing, the anti-inflammatory effects that we see with ketones being administered, and just from my perspective, the potential that ketone mimicry can have in a somewhat fed state, right? Because it's not physiological, really, in any way, shape, or form to have high levels of ketones circulating around in a fed state. That is not something that humans often experience, if ever. So to me, the fun part of this is we're mimicking a starvation environment when we're not starving. And I think the potential hormetic benefits of that are real, and I think something that we really need to look at.
Hello, Dr. Plaisance. You are a professor of nutritional sciences at the University of Alabama, and your research over the past decade has focused on how exogenous ketone esters affect metabolism, liver health, and body composition, and work that's now translating from promising animal studies into human trials. So, welcome to Modern Healthspan, and thank you so much for joining us today.
Thank you so much, Richard, for having me. It's exciting to join your program to get to talk about a very special topic on ketone metabolism. Thank you.
Thank you. So, Dr. Plaisance, most people think of ketones mostly with ketogenic diets, right? And or fasting. So why would someone who is not on a ketogenic diet or fasting be interested in ketones? Why are they important?
Yeah, so when we start to talk about ketones, I think it's an important first step, Richard, for us to sort of set the table for the listener to think about why ketones have really, why they're important to the body as you're asking, but also sort of what they are. If we can do that just quickly, as an initial step, that, from the standpoint of why ketones are so important, from my perspective, I look at it from from a humanity standpoint, from a human perspective. Ketones have really been shown over the years to have extended human lifespan. As we talk a little bit about longevity, from the perspective of many years ago, when food, and even in today's environment, in some countries where food may be less available, where food is maybe for weeks at a time, where people may be without it, the breakdown of fats from the body to actually to the liver can form ketones, and those ketones have been a source of energy for humans for many, many years in the absence of food. And so from that perspective, as you mentioned, people tend to think these days about ketogenic diets. They think about, fasting, or, long periods of calorie restriction where we may see some increases in ketone body production. But from the perspective of just thinking physiologically, the biggest impact that ketones have had on humans is the ability to survive long periods of time without food. Because as you know, these days we are quite good at storing fats. And those fats can be broken down for ketones. And the ketones that we utilize by the brain and by other major tissues in the body really provide energy sources that we need in times where there's not a large supply of energy there. So to get to your question about the idea, well, why would anyone want to supplement with ketones? And I think it's really a twofold or a two-pronged approach as we talk through this. Is the first is that ketones play very important signaling roles that we're just starting to learn. We don't have all the details at this point, but we know that there are several pathways, nutrient sensing pathways and signaling pathways that are engaged by ketones. And in many ways, in the environment where you're talking about adding ketones to the diet versus ketones being produced by the body through a ketogenic diet or through calorie restriction or fasting, when we take exogenous ketones by mouth, those ketone levels can go very quickly. And what I think we're doing in many ways is mimicking some of the nutrient signaling effects and receiving some of the benefits that we can talk about later, in terms of whole body responses in the brain as well as the liver, as you mentioned. I think the other aspect of it is metabolic from the perspective of, as most of your listeners probably know, ketones are very much capable of producing ATP, or major energy currency within the body. And because of that, they can be a readily available energy source. We think that metabolically, they're also doing some things from that perspective in terms of, whether you're looking within the brain or within the heart, as we start to talk about some of the cognitive issues that you mentioned with Alzheimer's, and even down the path of heart failure, where we've seen some real benefit to exogenous ketone supplementation during that time. So I'll stop there and let you interject, but that's sort of the setup I think that's important for the listeners to start.
So, one question on ketones as a fuel.
Yes.
So, we burn ketones, but we can also burn kind of fatty acids directly, right? So, when we're in fatty acid burning mode, we have ketones and we have fatty acids. So, where do they get burnt in different tissues? What is the difference between these two?
Yeah, that's a great question. We don't have all the answers to that, but what we know at this point is that you're exactly right. Fatty acid oxidation typically is going to be driven as at the same time where we see ketone production occurring. And from that perspective, and from what we know at this point, I like to think of ketones as being somewhat glucose sparing from that perspective, where when ketones are being produced, the brain in particular, despite the fact that it's 2% of our total body weight, about 25% of the total energy that we consume in a day is consumed by the brain. And so it's a very energy expensive organ. And so I think what's happening in terms of peripheral tissues, where skeletal muscle and the kidneys and other organ systems which are able to use fatty acids to be oxidized as fuel, where that drive and increase of fatty acid oxidation is meant to spare those ketones for the brain in particular, where in a period of starvation, for example, or frankly, if they're there, what we've seen is that they're going to be used. So if you take it from the perspective of exogenous ketone supplementation, even if glucose is present from the perspective of having had a meal in the last few hours, what we're seeing is that ketones are, for the most part, going to be preferentially used by the brain, and in many ways sparing glucose. And that sparing of glucose in many ways helps to spare lean body mass. And I think from the standpoint of human metabolism, as well as the survival of humans over the years where food may not have been at it, when it may have been scarce at times, that has allowed humans to be able to survive, because that glucose is oftentimes coming from amino acids within skeletal muscle. And that inability or that ability to break down skeletal muscle to provide glucose puts a human in a position where they begin to lose a significant amount of lean body mass, which then would not allow them to be able to search for food in the future. So I think from the perspective of, just thinking globally about your question, overall, what I think is happening is the fact that we are trying to spare ketones for where they're really needed within the brain, and even most recent studies showing within the heart, where they can really use ketones efficiently to produce fuel, sparing the excess fatty acids that you mentioned that are also going up for skeletal muscle oxidation and other organ systems as well.
So, as a messaging molecules, if we take exogenous ketones, do you think they are mimicking a keto diet? So it's like your body thinks you're short on sugar, and so it goes into this kind of starvation mode.
I think it does in many ways. There are, from a signaling perspective and from a metabolic perspective, there's indications that that is the case. And I'll start with the fact that one of the differences that I think that you probably have is the fact that, unlike a ketogenic diet, where what you see over time, over the first several days of starting a ketogenic diet, and particularly in the weeks that follow, you see this decrease in the secretion of insulin as glucose concentrations decrease, insulin sensitivity improves. So from the perspective of thinking about ketones and taking exogenous ketones, one of the things that's a little bit different is that we see an increase in the secretion of insulin following an acute dosing of the ketones. that happens to actually decrease glucose concentrations to some extent, at least with some of the ketones, the ketone salts, some of the ketone esters that are out there today. We've seen in my lab that we typically see a fairly significant decrease in circulating glucose concentrations that happens. So from that perspective, it's very similar to what you see with a ketogenic diet, that it does have this acute and really long-term effect on improving glucose metabolism. There have been a number of studies using multiple ketone precursors that show with oral glucose tolerance tests as well as insulin tolerance tests that there are improvements within, glucose metabolism within peripheral tissues. How that's occurring, we don't exactly know, but that's one of the real, I think, connections between ketogenic diet and exogenous ketones is this improvement in glucose metabolism that we see, despite the fact that you do see this sort of increase in circulating insulin concentrations. And so it'll be interesting as we go down the line to look at the effects that ketones have perhaps on the pancreas and in other organ systems as well. So from that perspective, there is that component. The other component that I think is a little bit different with ketogenic diet and exogenous ketones is that we haven't done the really long-term clinical trials in humans yet to show whether or not exogenous ketones can produce body weight loss the way that ketogenic diets do. Because one of the unique aspects of a ketogenic diet is that in most people that initiate a ketogenic diet, Richard, you do see a significant loss of body weight, which, as you know, is going to have a significant impact on its own in terms of improving glucose metabolism and metabolism in general. And so we really don't have enough information at this point with exogenous ketones to really show whether or not they have an impact on, body weight loss. As you mentioned, some of the work that we've done in the past with multiple esters, we've shown that, at least within mice, that we do see a significant weight loss that happens following the induction of obesity. And in lean mice, we see those mice not actually adding as much body weight. And that's on a number of different types of dietary backgrounds, from high fat diets, high fat, high sugar diets, and even low fat diets, where we're seeing that in the aging mice that we've been working with. We have not translated those studies over to humans yet, so there's still a lot left to be learned when it comes to the effects that it might have on body weight. So I think you have to break it down based on weight independent or weight loss independent and weight loss dependent effects metabolically.
It's just looking at ketogenic diets for a second. As we get older, I mean, so the idea of a ketogenic diet is that you become low in glucose, and then your liver generates ketones to make up for that. Is there any change in the way that we generate those ketones as we get older?
Yeah, so one of the things we're beginning to learn more about is a key enzyme within the pathway of ketogenesis. And this particular enzyme is designed to, it's one of the rate limiting enzymes within ketone production. We've seen this both in human studies as well as in animal studies, that with age, and in particular in aging humans and in aging animals, where there is a metabolic dysfunction that's happening as a result of a high fat, high sugar diet or Western type of diet in humans, what we're seeing is that the enzyme, which is called HCAR2, it's one of the rate limiting enzymes within the production of the ketogenic pathway. We begin to see that enzyme's activity and expression begins to go down as individuals age and as metabolic dysfunction begins to develop, whether it's age related or not. And so because of that, the ultimate production of ketones is actually beginning to decline. And we're learning more and more about this. There's some really groundbreaking studies in the last year or two that have been done and conducted in animals and now in humans that show that ketone production is thought to, and this is a controversial area, Richard, that some of the latest studies are showing that ketone production does in fact go down. The impact that has, for example, on metabolic health is not completely clear, but the ability to produce ketones, to answer your question, does seem to decrease with age, and in particular with metabolic dysfunction, which will accelerate that age-related process.
Do we, if we eat a carbohydrate diet, do we always have like a few ketones around, or is it just like none?
We always do. There are micromolar levels of ketones that are consistently circulating, and that's a result of the fact that when we go through the process of beta oxidation of fatty acids within the liver, where the primary production of ketones are happening, we know that there are even micromolar concentrations of those that are necessary to happen. And we're learning more and more about that, even postprandially after a meal, that the ability to produce ketones is one way to basically shuttle carbons out of the liver where they can be oxidized in peripheral tissues like the muscle and the brain, which I think is one of the most intriguing areas that we've begun to explore. Because if you think about it from, whether it's, a high level of caloric consumption, or as you suggested, a high, consumption of carbohydrates coming in, a lot of those carbohydrates are going to go through a process of de novo lipogenesis within the liver, forming fats. And those fats have to be dealt with. And part of the way that we deal with those is to actually produce ketones following that meal where those fats are being produced. And it's another way to offset or offload some of those carbons from those fatty acids that are being produced so that other tissues can help to oxidize those. That's one of the key areas that we've been really trying to work to understand better how the peripheral tissues are working to oxidize those additional ketones. But no, it's a fascinating area. And I think, most people think of ketones being produced only during the fasting or starvation state or during a ketogenic diet, as you talked about earlier. But there's so much more to it. So even after a meal, we are consistently producing ketones. And I think we take for granted, even though they're at micromolar concentrations or even low millimolar concentrations, how important they are.
Is there any particular population that would benefit from exogenous ketones?
I think what we're beginning to see now, Richard, is that we're in a position where I think we've really, over the last 5 years or so, really begun to get at that question. And one of the areas that we really got intrigued by, and we sort of missed it from a timing perspective, was during COVID. COVID was one of the real key times where we got interested in this because the anti-inflammatory effects. I mentioned earlier in our conversation about the impact that ketones can have on nutrient signaling pathways. They also have impacts on anti or inflammatory pathways. There's some really well conducted studies that have been done now in humans. They were previously in animal models that show quite nicely that ketones have a broad effect on a number of inflammatory pathways, namely the NLRP3 inflammasome. This is when COVID was happening, when, all of the ventilation, that was needed during that time when people were dying and it was so severe. One of the things we were really trying to do was to get in on some of those clinical trials with some of our folks here at UAB to really get an understanding of the potential role that ketones could have in reducing inflammation during that, the acute response to the virus. And we never got around to those. Some had, theorized on that. There were a few publications and reviews that were published on the topic. I think that there were some studies in Europe. I'm not familiar with those studies in terms of their publication and what they found, but I know that there were some that were ongoing that showed some favorable effects in reducing the inflammatory cascade, because that NLRP3 inflammasome is one of the major reasons why people went from a relatively okay state to needing a vent at that point, but because they had this huge rush of inflammatory response that was happening with this viral production. And so, could they work in that environment in an inflamed environment where we're talking about, viral or, and so forth? I think that's an area that has not been, looked at tremendously, but I think that's a major area. Any conditions that have significant inflammatory responses, from skin to, a number of other chronic disease conditions I think could be potentially effective. We have been working in the cancer space as well
Mm.
recently, and we have not translated these findings over to humans yet, but we have a couple publications now that we've done in animal models of the 4T1 breast cancer model that women often develop. And one of the things that we're seeing in the mice that we've published is that the ketones, one particular ketone that we've been giving, an exogenous ketone to these mice, has similar effects on reducing the progression of cancer and metastases almost as effectively as some of the immunomodulators and chemotherapies that are actually being used in these mice. Now, again, this is premature, so I do want your listeners to know that this is not an advocacy for, clinical use at this point. We're not that far along, but it is exciting to think in the cancer space that at least with some cancers, we think at least with this 4T1 breast cancer model that is really a major issue for many, many women and men, is something that we have to really look at. The other areas that I think are really exciting, you mentioned Alzheimer's and cognitive dysfunction just in general. We have done a couple studies now in sport-related concussion. We've looked at other forms of mild TBI in Army and other military venues, looking at the capacity of ketones to actually improve brain function, following a concussion, or to even, help from that perspective in terms of some of the deleterious effects that happen with cognition. And the results are, and these are very preliminary studies that we've done now in humans. The results are very encouraging from the standpoint that ketones are being taken up in the human brain. They are being used, and we do have a sense that they do seem to acutely improve cognitive function in some of those venues when it comes to brain-related, cognitive dysfunction. I think another area that we're seeing is from a cardiovascular perspective in heart failure. Ketones are very efficient as a fuel. And I think this is a largely untapped area, but I'd love to see ketones get into the space of heart failure as a treatment. Like I mentioned, ketones are very efficient fuel. They actually produce more ATP per mole than glucose, and so they can be quite efficient as a fuel. And so in the heart failure space as well, so there's a number of different areas that we're beginning to explore this in, but the last piece that I'll talk about that we've really been, I like to think instrumental in sort of moving the needle a little bit, is in the area of fatty liver disease. And we've done a number of studies now in animal models with multiple ketone precursors that, even in parallel with the ketogenic diet, showing that they were even more effective than a ketogenic diet on decreasing hepatic lipid content, decreasing inflammation within the liver, and decreasing fibrogenesis within the liver, all of which we think could have an important effect on reducing what we now call metabolic associated steatotic liver disease, which for sure would be fatty liver disease, which is one of the real major problems that we're seeing in developed countries right now, not just associated with obesity and insulin resistance, but even outside of that.
Okay. So double clicking on a few of those. Well, let's start with the fatty liver, actually. There must be multiple different mechanisms going on because there's many, like in the brain, it's maybe providing energy, but in fuel, but probably in the liver, it's different. But why would providing kidneys reduce fat in the liver?
Yeah, that's a fair question. It's a question that we get frequently. We are not clear on exactly the mechanisms by which this is happening. We've seen it in a number of different animal models. We're really trying to get this in the human space at this point. But to answer your question, what we think is happening at this point, people tend to think of the liver as this sort of solitary organ of hepatocytes. And it's much more than that. There are, hepatic stellate cells. There are a number of other cell types that are found there. And one of the things that we've been seeing is not only direct impacts on the hepatocytes within the liver, but also in the hepatic stellate cells. And one of the things that I think is really interesting about that is the fact that you have resident macrophages that are also present within the liver. And we now have direct evidence that ketones, when they're administered by mouth, whether, in animals at least, what we're seeing is that those animals have a reduction in, and this is also in cell culture as well. So we've taken the cells out of the animals. We've looked in cell culture just to see if these are direct effects or if these are modulated by some other effects that we're seeing in the animals. And even when we take the cells out of the animals and we harvest them, we grow them, one of the things that we're seeing is that in some of these cell types is that we have this anti-inflammatory cascade in the resident macrophages, and so we have a reduction in inflammation. We have also signaling effects that we think may be leading to a reduction in fatty acid production. We also have shown recently that there is an increase in fatty acid oxidation, which I think is very interesting as well. So we're giving a ketone and it's driving fatty acid oxidation. And I will give you this, that doesn't make a whole lot of sense to us from the perspective of actually giving a ketone and seeing an increase in fatty acid oxidation. But we recently completed those studies, and it's very definitive with multiple exogenous ketones. And compared to a ketogenic diet, is even more profoundly effective in terms of increasing fatty acid oxidation. What we don't have a clear understanding of is the impact that it has on de novo lipogenesis that I mentioned earlier, where we're producing fats from non-fat sources. We don't know exactly yet. That's an area that we haven't really probed. We're starting to probe at this point. It could be that we're seeing a combined reduction in the production of fats as well as an increase in oxidation, which we've now confirmed more than once to show that fatty acid oxidation seems to be increased. Now, the transcriptional, and nutrient signaling pathways that are leading to that, Richard, we're less clear about at this point. I don't know mechanistically what's driving that. One of the key pieces we have seen, though, is that at least with some of the exogenous ketones, we do seem to ramp up the HMG-CSH2 component of the pathway, which is one of the major key regulatory ketogenic enzymes within that pathway. And we think that could potentially be important in terms of, at least some of the ketones in terms of driving ketogenesis and driving fats away from the TCA cycle where they're completely oxidized or into de novo lipogenesis in that pathway. So we think that it's driven by fatty acid oxidation. We're not exactly, and my hypothesis is that in part what that's doing is we're actually, the ketones are driving that fat oxidation, which is keeping those fats away from other components going into the de novo lipogenic pathway, for example.
If it's having this effect on the fats in the liver, does it have any effect on your blood lipid panel on the triglycerides or HDL or LDL?
We have seen that circulating triglycerides are decreased, so there is a one-to-one connection between the two, that when we do see a reduction in the hepatic content of triglycerides, we do see circulating triglycerides down. We have not seen any decreases or changes in total cholesterol or HDL cholesterol, LDL cholesterol. But keep in mind that, and these studies have mostly been conducted in mice. Mice are not exactly a good model when you're looking at lipid metabolism. The carriers, HDL, LDL, they're actually reversed in animals compared to humans. So where humans, we consider HDL cholesterol good cholesterol, LDL cholesterol or be bad cholesterol, it's actually the reverse of that in mice. So I've always sort of, we look at triglycerides and that's a pretty good signal and marker that, there's sort of this expected reduction that we would see from the liver to the circulation. But we haven't seen anything within total cholesterol or other components of cholesterol carriers. That said, I've seen some recent studies in humans where even with short-term administration, there haven't been any changes that I've seen in any of those lipid components in humans.
Returning to Alzheimer's, so we talked a little bit about where we you talked about TBI
Yeah.
and Alzheimer's. So my understanding is that Alzheimer's, the benefit of ketones is because they replace glucose, and glucose, your body basically becomes, your brain can't take up glucose, but you become diabetic. Uh, is this the same for TBI? Well, first of all, is that your understanding of how ketones help, and is that the same for TBI?
Right. So let's start with the concept that you mentioned of, the diabetes, if you will, of the brain that many have associated with Alzheimer's. I think there's some partial truth to that. I think that there is a insulin dependent effect that begins to decline. We see some of the glucose transporters like GLUT4 begin to decrease in that environment of aging where we see Alzheimer's developing. There's certainly some evidence that other components within the insulin signaling pathway are decreased. But we also know that there are some insulin independent effects as well that are happening that discourage the use of glucose at a cellular level within the neurons and other types. I'm on the fence a little bit about the term, in terms of likening it to type 3 diabetes, as many people refer to it as. And I think that that's okay. I think there is a component to that. I think that there's much more work that needs to be done to sort of get at the mechanism of where we're going with that. And to get at your point, I do think that there are a number of studies that are showing quite nicely that, when ketones are present, they do replace glucose as the fuel. And if what we're seeing in the literature holds up, that in this state of cognitive dysfunction, in a severe case with Alzheimer's, that there is a reduced ability to take up and to utilize glucose as an energy source, that ketones are then able to do that. We are unaware of any instances in humans where the ability to take up ketones is impaired from that perspective. And so without that impairment happening, ketones can replace about 60 to 70% of the glucose that we need as a fuel within the brain. And so, the theory is that if you're giving ketones in that environment of Alzheimer's disease, and even potentially as a preventive measure, are you able to reduce that requirement for glucose and to allow ketones to be taken up and then produce ATP as that alternative energy source? So that's the current state of the art in terms of where we are at this point. Getting to your question about mild TBI, there are some very similar acute responses that are happening. So there are a number of studies that have shown that in the days following an acute mild TBI, whether it's sports related, vehicular crashes, or whatever it might be, that the human brain undergoes a period of inflammation and what we call hypometabolism. And it's glucose hypometabolism in particular. And that happens about 2 to 3 days after the event occurs. And we've hypothesized that during that time, providing exogenous ketones could be an incredible way to reduce the overall acute as well as potentially chronic impact of sustaining a mild TBI. And again, there's really not, those studies need to be done. We haven't really done a good job. We're proposing those studies right now. Others I know have been working on those. I don't think there's anything definitive at this point, but theoretically, it makes sense that in the environment where you have glucose hypometabolism occurring, much like you would see in a state of Alzheimer's disease, that what you could potentially do is provide those ketones as an alternative source of energy. I'd also add that the fact of the matter is that the anti-inflammatory effects of ketones could potentially be important here as well. So by binding to, for example, and create, not even binding, but really activating or inactivating the NLRP3 inflammasome, for example, as one key inflammatory mediating cascade, could potentially have significant effects on, reducing that inflamed state during a concussion, which would also enhance glucose uptake, for those individuals as they recover. And I think the space with exogenous ketones could potentially be where we want to go. Because the problem with ketogenic diet is if the athlete or if a person that sustains a mild TBI from whether it's military, vehicle accidents, whatever it might be, they're not if they're not on a ketogenic diet, as most people know, it takes a few days for you to actually get into ketogenesis when you start a ketogenic diet. So I think the potential for exogenous precursors to actually come in here and really save the day because you could provide those if you consume these by mouth. And what we've seen with multiple ketone esters is that you see a really rapid within about 10 to 15 minutes after consumption, you see a really rapid dose dependent increase in circulating ketone concentrations. And those can be sustained for as well 4 to 6 hours following consumption, depending on the dose.
Just thinking about it, Alzheimer's is also an inflammatory disease to a large extent.
Yes. Yeah.
And so that would also help with that, you would think.
We anticipate that it would. We are currently conducting trials. We have some very state-of-the-art imaging equipment here. One of my postdoctoral fellows in the lab right now, Kat Sweat, is actually conducting a study in individuals with pre-diabetes at the moment to see if, so we have shown at this point, and this is really, I think, information that is beginning to others are starting to see as well, is that we do see some cognitive dysfunction in those individuals with prediabetes compared to those that have normal glycemia at this point. So we've been able to show that, and others have shown that as well. We're not the first to show that. But I think within that space that we're working in right now, one of the things that I think we're most excited about is the potential that we have from an imaging perspective to look at some of the anti-inflammatory effects within the brain here at UAB. So I don't know that, we will be able to get all the answers in humans, but certainly we're working towards tracers and other imaging techniques that we can use to look at these anti-inflammatory effects. So stay tuned for that. I think we're going to see that actually in the future. I'm hoping we'll have those results pretty soon.
Just a thought, why is there so little kind of research been done on ketones? Because they're very safe. You would think it'd be quite easy. I mean, no human trial is easy, I'm sure, but it'd be quite easy to do a human trial with ketones because the safety profile is understood.
Right. Well, here's my perspective on it. And I think this is probably consistent with other researchers in the field that are studying ketones and ketone metabolism, is that there's still this misconception that goes back to really the early 1900s when you think about type 1 diabetes and you think about, diabetic ketoacidosis, you'd be shocked at how many people still to this day in medicine and beyond still look at ketosis and go, whoa, we don't want to talk about ketones because ketones are bad, because they think about it as type 1 diabetes, they think about ketoacidosis. What we're talking about here, whether it's ketogenic diets or we're talking about exogenous ketone precursors, for example, we have feedback systems that limit how high those levels actually get. So on a ketogenic diet, for example, you know, others have shown in the past maximally 6 to 7 millimolar concentrations, where with type 1 diabetes, they could get up to 20 to 25 millimolar concentrations. That is certainly a problem. But at 6 to 7 millimolar, it's not problematic at all. So part of the problem that we've seen over the years is that there's still this misconception between nutritional ketosis that's induced by a ketogenic diet or that's produced by exogenous ketone supplementation versus what we see in the ketoacidotic state with type 1 diabetes. And so there's still that misconception. I think the other thing too, and we've seen this in some of the submissions that we've had with grants, where there's a misunderstanding when we say ketones, people automatically go to ketogenic diet and they think we're doing a ketogenic diet. So oftentimes there's it's been difficult to get funding because of this misconception that, oh, ketogenic diet. And there are still so many people that are against doing ketogenic diets in that it's such an extreme diet, as you know, Richard. I mean, less than 5% carbohydrate, 80 to 85%, fat. And it's a low protein diet. And so that too is sort of, at the crux of it in terms of that. And then at the end of the day, I think it's just starting to emerge. I mean, this really didn't pick up steam until 2012. When the ketone monoester, for example, that Richard Veach produced came out, he and Kieran Clark, produced that molecule. It came out, and suddenly, there was kind of this revamped interest. At the same time, you get ketogenic diet picking up steam. So we're starting to see it happen. But as these things go in nature with clinical trials, these things take years, as you mentioned earlier, to do. So part of it is they're underway. They just haven't been published yet, so we're not seeing them. Um, but I'm hopeful that we're going to continue to gain traction on it because the more we talk about it, the more we're seeing the potential benefits. And I think we really need to explore this.
So you've mentioned ketone esters, ketone salts. We also think about MCT seems to be a way of raising ketones.
Right.
Could you explain what's the difference between them and what's when you should use one rather than the other, what the benefits are?
Right. Yeah, so it's a great question. And so MCTs are medium chain triglycerides or fatty acids, and of course, one of the great things about the consumption of those medium chain fatty acids is that unlike long chain fatty acids that eventually when they're consumed, they'll go through the lymphatic system and make their way over to the liver and get oxidized is that when medium chain fatty acids are consumed, they go directly from the portal vein to the liver. So they basically, come at a very high concentration rapidly to the liver. So because of that, the production of acetyl-CoA, which is the ultimate two-carbon breakdown of beta oxidation within the liver, they're producing these ketones at a very high level. What I like about these medium chain fatty acids is that they provide what I consider to be a sustained increase in circulating ketone concentration. So you consume, between, 15 and 30 grams of the MCT, and suddenly for many, many hours after, you have this sort of sustained level of ketosis, both beta hydroxybutyrate and acetoacetate levels, the two primary ketones that we see in circulation, are increased. And one of the things that as you asked the question about exogenous ketones, when we think about what's out there available, so the ketones are typically going to be esterified or they're going to be conjugated with salt. So you have ketone salts that are going to be, beta hydroxybutyrate that's conjugated with a salt like sodium or potassium, and then you can administer it. And remember, these are acids, so that's why they're conjugated or esterified. And so, from a digestive standpoint, to ease the pH and acid base balance and many other things that would disrupt the GI system, that's why we're doing that. But one of the areas we've really been working with is in ketone esters, and there are a number of them. Day by day, they continue to increase, the ones that are out there on the market right now. But butanediol, which is an alcohol that was actually studied in the early 1950s by DARPA, a component of the Defense Department in the U.S., actually produced and was studying this butanediol alcohol. And what we know is, unlike what I just mentioned in terms of oxidation within the liver in this traditional approach that medium chains do, butanediol is broken down very similar to ethanol, but produces, because of these oxidative reduction reactions, we produce beta hydroxybutyrate, for example, from butanediol directly. And that can provide a rapid source of energy. And that's why, Department of Defense, the Space Administration was looking at these as a source of energy, even in the 1950s and 60s. They've now been conjugated or esterified to a number of other components. Beta hydroxybutyrate, they've been conjugated with medium chain, the C8 octanoil, for example, is conjugated to butanediol. There's others as well that are out there on the market at this point. One of the things that I really like about these conjugations is that they offer us in the research space really an opportunity to look at, if it's conjugated with BHB versus acetoacetate versus octanoil, they're going to have dramatically different effects because there are some signaling components that we know, many that we don't know at this point that are beginning to emerge. And so, for example, with the bisoctanoyl butane diol that's out on the market now, one of the things with that product that I really like is the fact that it's a conjugation of a medium chain fatty acid along with butane diol. So you get the butane diol metabolism in the liver that's happening with alcohol dehydrogenases, the same ones that break down ethanol to actually produce BHB or beta hydroxybutyrate. And then you have octanoil that is actually going through and being taken up by the portal vein in the liver rapidly, as I mentioned, like other medium chain fatty acids do, to produce ketones in a sustained fashion. So to me, it's one of the exciting ones on the market right now because you have this opportunity for a short-term rapid increase and then a sustained release. And some of the studies that have been done with that molecule have shown, up to 4 hours, and I think probably beyond that, where ketone levels are elevated.
Oh, so you did a study looking at a salt and a mixture of a salt and an ester, and which was
Yes.
better tolerated and so on. So, what are the kind of tolerability or concerns um, with ketones?
Yeah. So exogenous ketones that are the primary risk that we see, and this is more so what we're seeing with the ketone salts, is that there are gastrointestinal disturbances that we see from just nausea and other related type of things that people are experiencing. They're pretty acute. We haven't seen any. They're in mild as well, and they're very transient. They go away quickly after an acute dose. They do seem to clear up and get better over time. But the number one thing that we see is a bit of nausea that's associated with that. And again, we see it more so with the ketone salts as opposed to the ketone esters. If there can be some dose-dependent effects with some of the ketone esters that are out there. In the study that you mentioned, we compared a ketone monoester and monoester salt combination. And in that combination versus the monoester, we didn't see a significant difference really in terms of the GI disturbances, between the participants in that study. And I think that's because we used a very low dose amount within that study, just to look at tolerability and acceptability of that particular source of ketones. I think if we used higher doses, and we probably do need to use higher doses for some of the applications that we've been talking about, that's left to be determined at this point. But what we were trying to do in a young, healthy population was really to kind of look at, what are some of the pharmacokinetic responses that happen. The pure ketone monoester that we used had a much greater impact on raising ketones rapidly and sustaining those. That was the big difference that we saw between the two. In terms of, from the perspective of thinking about the salts, I think there are certainly some applications for the salts. When we talk about those would be the beta hydroxybutyrate, sodium conjugated, molecules that are out there. There's a couple things that you have to consider with the molecule. First off, is it's a sodium load, and a lot of the ones that are currently available in the market have, anywhere from 500 to 1,000 milligrams of sodium that are a part of that dosing that's actually taken at one single dose. And so there's a little bit of concern about that. We think that's in part why some of the GI disturbances happen. And it's in part why the ketone esters actually were created in the first place, was because of concern for that sodium load that's happening. I think we still have a lot to learn from that perspective when it comes to those ketone salts. Is it negatively impactful in individuals that are taking it? And I think it's population specific. I think there's many athletes now that are taking ketone salts, for example, and other in ketone esters. Is it impactful in those individuals that are healthy, that have normal kidney function, that are not hypertensive and really not at risk for hypertension? I think there's still a lot to conclude before we go a whole lot further from that perspective. The other big thing to think about with ketones in general is that some of the ketones that are out there now, also with beta hydroxybutyrate, for example, the salts often have what we call a racemic mixture of both the L and the D form. of the ketone beta hydroxybutyrate. We know that beta hydroxybutyrate in the D form is the biologically relevant or active form. And, in some of these, it's a 50-50 blend of the L and the D form, which I think has really muddied the water a little bit in terms of what we know because what we're beginning to learn is that the L form actually slowly does get broken down or oxidized into the D form, which actually could have some utility from that perspective. We just don't have enough information at this point. It's wide open at this point, Richard, from my perspective in terms of the potential there and potentially with the risk as well. But I think the potential benefits are a little bit cloudy in part because there's so many different molecules. And I think that they have really unique effects that we have to study and understand individually.
If we thought about the um, so you say it raises rapidly and then actually sustained as well. I mean, could you put some times on that? I mean, how
Sure.
rapidly and how long does it last?
Right. So keep in mind at the outset that very much what I'm about to tell you is dose dependent. And we have, and others have shown that regardless of the ketone that we're talking, exogenous ketone we're talking about here, is that there is a dose dependent effect. But in general terms, what we see typically is within 10 to 15 minutes following oral consumption of ketone salts, ketone esters, is that there is a significant dose-dependent rise in those ketone concentrations that can range anywhere from zero point 0.5 millimolar at sort of the base of what we consider to be ketosis, all the way up to 2.5 to 3, even 3 millimolar concentrations in some individuals. Some of that is weight dependent. So you've seen some studies that have been published where it's just been given on a total body mass. Some have given it per kilogram body weight, for example. And, I haven't seen dramatically different results with those types of experimental design strategies. But what we are seeing is very much a dose dependent increase anywhere from zero point 0.5 to 2.5 or 3 millimolar concentrations rapidly within 10 to 15 minutes. And then also the thing that's important when you ask about the sustainability or duration of that level of ketones is that also is dose dependent. So the higher the dosing, we're seeing that we have a sustained increase up to 4 to 6 hours on a single dose. Some of the more recent studies that I was talking about earlier with bisoctanoyl butanediol, with that molecule, that precursor has shown in some of the recent studies that have been conducted that they're seeing up to 4 hours where it was measured. They didn't measure beyond 4 hours in some of these studies, but what I was seeing were concentrations that were even above 1 millimolar concentration 4 hours later that might have peaked up to 2.5 millimolar within 10 to 15 minutes, 30 minutes in some cases, in some studies, but sustained out for 4 hours at 1 millimolar or higher during that time.
Interesting. So, what's the best way to measure, actually? Uh, so, I guess both in the lab, I mean, is it like blood or urine or in the lab or and kind of for consumers?
So for the consumer, what we have at this point is we're limited. There are really two ways that we can go about measuring ketones at the moment. So there are a number of commercially available ketone meters. They happen to actually measure both ketone as well as glucose concentrations in many cases from an application standpoint. Unfortunately, the technology is only at a place where we're able to measure beta hydroxybutyrate at this point. And we're not able to measure acetoacetate from a point of care device that would be available to the consumer. What is available to the consumer at this point is some of the semi-quantitative strips, the urine strips that are available if you wanted to measure acetoacetate. That still can be conducted, but that's, as you know, a very semi-quantitative. It's based on an image of, the coloration or discoloration of a chart that's on the outside of the tube that you actually look at and estimate the concentration. So it's very semi-quantitative. It does give you a sense of acetoacetate from that perspective when it comes to the urine. I'd also add that there are some meters as well, some breathalyzers that are actually available on the market as well for the consumer to be able to measure acetoacetate concentration. So one of the things that we know is that, acetoacetate actually uniquely gets broken down into acetate. And so some of it that spills off in the lungs from acetate to acetyl or, to acetone, you can actually breathe off. And in micromolar concentrations, that can actually be measured by mouth. And so there's a number of companies that have produced devices to breathalyze and measure that. And like I said, the BHB can be measured with a point of care finger stick device that's out there. There's many companies making those now as well.
So what should we be aiming for? And at what point does the blood level start making a difference to the metabolism?
So can can you repeat that, Richard? So I'm not understanding the question. I'm sorry.
So, yeah, what level should we be aiming for? I mean, we can measure,
Okay.
right? How many millimoles?
Yeah, I
And
see.
is
Yeah.
there like a threshold below which the ketones are no longer having a metabolic impact?
Yeah, that's a great question. I don't know that we know the answer to that. But it is a fundamentally important question that needs to be addressed from the standpoint of how high do we need to actually get these ketone concentrations? I don't have a definitive answer for you because the research really hasn't been done to demonstrate. And I think it's going to be dependent on what you're trying to do, right? If it, is it what I hope we will see is that at minimum doses, there is a benefit. I expect that there will be dose dependent responses. The question comes down to how much you're giving from the perspective of by mouth versus how much you're actually seeing in circulation, and is that important? So to back up for just a second and answering your question, it's really a difficult thing to do because if you just gauge it based on the circulating levels, it doesn't give you the full picture. What we really need to do to really get at the answer to your question is, and this has not been done, is to actually trace using tracers in the human body to look at turnover of ketones. So from them being consumed and having tracers bound to see where they're actually going and how rapidly are we urinating them out? How rapidly are they being signaling? How rapidly are they being metabolized? And then to get at your question, what is the concentration that's needed to have an effective dose to do whatever it is you're trying to do? So if it's cognitive function or dysfunction that we're working on, that may take a certain level of circulating ketone concentrations and frankly cellular concentrations that we don't know at this point that very much could be different than what we see at the level of the heart or at skeletal muscle. And we have some profound data in the heart and within the muscle, but what we don't know is the dose dependent effects. We know that they're really high levels, they're high levels within the tissues. We know that they're high circulating levels, but how high? That I can't answer at this point. Unfortunately, it's not available. The tracer studies are going to be needed to get at that question. And I agree with you. It's a really, really important question that we address.
Okay. So what would a typical dose for a ketone be? The kind of ones that you would use in your testing?
Yeah, so we typically in humans are doing anywhere doses from 12 all the way to 25 grams of a ketone ester, depending on the type of ester that we're using, is what we're typically doing. We've gone back and forth. Some of our studies have been done on a per kilogram basis, body weight basis. Some have been done from a practical perspective just to get at straight, you know, 12 grams, 25 grams, whatever it may be, that the ketone is that we're using. And a lot of that is dependent on, again, what we're trying to do. One of the studies that we did in patients with cystic fibrosis, we used a very low dose. It was around 12 grams that we're giving twice a day is what we're giving of a ketone ester. And one of the things that we were really excited about in that study after 7 days of the patients being on the ketone ester was that they had a significant reduction in sputum-based inflammatory markers, which we talked about earlier, that the anti-inflammatory effects of ketones, I think, are pretty profound in a number of environments. And in our recently completed and published study with cystic fibrosis, or patients with cystic fibrosis, a remarkable decrease in sputum-based inflammation that we saw, which didn't translate to an improvement in pulmonary function per se, but the subjective feelings that these patients had of improved cystic fibrosis condition was really dramatically changed, their perception of that. And we found these results to be pretty profound because, everyone's familiar with, the GLP-1 receptor agonist in the space of weight loss and weight loss interventions. But within the cystic fibrosis population right now, there is a game-changing drug that was released, or set of drugs called they're modulator drugs that basically help to fix some of the genetic issues that are related to the deletions that happen in some of these, within the DNA, or within the expression of cystic fibrosis. And what's really unique and profound, I think, is the fact that the ketones have this ability to reduce inflammation in that type of environment. So,
I just had a thought. Does exogenous ketones help with physical performance, given that they are a energy source for the heart?
right. So there have been a number of studies now that have been conducted with various ketone esters that are out there in the market. I think there's been a couple with ketone salts as well. By and large, there are some studies that have shown improvements in time trial performance with cycling, for example. But I would say that the overwhelming number of studies that have been conducted to this point are not showing performance benefits related to ketone consumption at this point, unfortunately. Theoretically, it makes complete sense, right? You base it on the idea that we talked about earlier. If you can spare glucose and glycogen for later points in an event like a marathon, or the Tour de France, where a lot of guys are actually drinking many different types of ketone esters, the performance related benefits are not clear cut at this point. There's much more that needs to be done, but by and large, the majority of the studies that have been done are not showing any benefits to performance for the athletes, which to me is very surprising that we're seeing that. I do think that there are larger studies that need to be done, with to really get at this in a bigger way. A lot of the studies that have been done have been very small in nature. You can imagine it's really difficult to conduct a really nice study, in the tour, for example, when you're out in the field like that, and in some of the controlled laboratory environments, that's a completely different situation than you might see on the tour. And so I think there's a lot that needs to be done there. The more of the evidence seems to be in recovery, but I've seen that too, that it's sort of mixed at this point in terms of the results. I think there were a couple of studies that showed that it helped in recovery, and I think a lot of the tour athletes were drinking it from a recovery standpoint. But I think that also is very much in question at this point. Does it actually help to improve recovery or not? I think it's too early to tell.
So for people taking ketones, any other advice? So 12 25 grams, which sounds
Right.
a lot. Is that like once a day, twice a day, with a meal, without a meal, anything to worry about?
Yeah, I generally, like I said, I would encourage people to start off with a lower dose and ramp up. And again, this is not medical advice. I'm not a physician, but as a supplement, and thinking about it from that perspective, providing ketones, regardless of what you're using it for, I would say using the lowest recommended doses by the manufacturer, and then ramping that up to some of the higher levels, which typically depends on the type of ketone ester that you're actually consuming. It could be, like I said, from 12 to 25 grams a day, or in higher in some cases. But in terms of the times of day, typically anywhere from 2 to 3 times per day is what we're seeing. I like to see those spread out throughout the day. In terms of my own personal regimen, I typically try to consume ketones twice a day. and generally in the morning. And I try to do that as well in the afternoon, sometime at the middle of the day. So I typically don't consume my first meal until noon time. And so I'm, coming off an overnight fast. I typically will consume a ketone ester first thing in the morning. I may have it as part of my coffee, for example. I oftentimes will have black coffee, and that usually kind of gets me going throughout the morning. But I usually have about 12 to 25 grams, depending on where I am in time and space, for that morning coffee, and then I'll typically have it again in mid-afternoon. Most of the ketones that are out there today are pretty resilient to meals, but there is a bit of a decrease in the amount that you'll see in circulation. For example, if you have a high carbohydrate meal where insulin concentrations are already increased, you will see a much lower measured level of circulating ketones, and well, at least with some of the ketone esters that are out there. I don't think that's been seen with bisoctanoyl, butane-diol. I think that's actually been pretty well sustained following the meal from a couple of the studies that I've seen. Some of the other ketone esters that are out there that we've worked with, though, we do see that if you consume it with a meal, you'll see a response that could be as much as 50% lower. Is that is that a bad thing? We don't know. So it's hard to say, you should or shouldn't do that. But I try in my own personal use of it to try to consume it at a time where I don't have a lot of food in the system so that it can actually increase the levels to as high as I possibly can with the lowest dose. And then in terms of just thinking about, implications, and the only thing to be leery of is the fact that, some people may experience some gastrointestinal disturbances. We have not seen with really any of the ketone esters that are out there anything other than that in terms of negative consequences over the short term or long term.
Can I ask what's your goal in taking the ketones?
My personal goal, if you're
Yeah.
asking personally, my personal goal is from a cognitive standpoint, as well as from my perspective. I will tell you that from an exercise standpoint, I do feel more energized actually in the morning. And I think that's probably a bit of a placebo effect. I don't know that the evidence is out there to suggest it, but I do feel more energized in the morning. Because the other thing I didn't mention too is I typically will have that cup of coffee. I will have a mixture of ketone ester within the coffee. And then typically an hour, hour and a half later, I will go and do a workout, both resistance and aerobic exercise. And I do find, particularly with the resistance exercise component, that it actually helps me. Because keep in mind, I'm coming from, typically my last meals at 8 or 9 o'clock at night. So I'm limiting. So my glycogen storage within the liver is probably, in the down part of the curve. And so without, the ketones present, I do feel a little less energized when I go in and do the resistance training. But if I supplement with the ketone ester before I do that, again, I don't know the science, if there's any science to support that. We certainly haven't looked at that. I don't know that others have as well. But my perception of the workout is actually much easier when I'm actually doing it. If I have the ketones on board. So for me, it's a combination of as I'm aging, one of the things I can tell you is that from a cognitive standpoint, I feel sharper actually. Particularly, part of it's the diet. Okay. Part of it is I've been doing time restricted eating for a period of time where, as you probably gathered from what I mentioned, my last meal is at 8 p.m. Typically won't eat again until 12 noon the next day. And so that's having an impact in and of itself from a cognitive standpoint, from my perspective, because I do my best writing in the morning, I do my best work in the morning during that period of time. And during the day, if I try to write in the afternoon, for example, I see a really big difference in terms of my cognitive performance. So from that perspective, as someone who's in academia, to me, that's one of the great benefits of it. And then add to that the anti-inflammatory effects as well. To me, as an anti-inflammatory agent, even if none of the other things that we talked about work from the perspective of translating the mouse work to humans, the liver, the heart, these types of things that we're seeing, the anti-inflammatory effects that we see with ketones being administered, and just from my perspective, the potential that ketone mimicry can have in a somewhat fed state, right? Because it's not physiological, really, in any way, shape, or form to have high levels of ketones circulating around in a fed state. That is not something that humans often experience, if ever. So to me, the fun part of this is we're mimicking a starvation environment when we're not starving. And I think the potential hormetic benefits of that are real. And I think something that we really need to look at. But there's so much science yet to be done, Richard, and it's an exciting field and one that I think we need to continue to explore just to get at in humans, the answers to the questions you're asking me about from a personal perspective in terms of why I take it. So.
Right. Just is there any claims that people that you see people making about ketones that you think people should be aware of because they are just not true?
Yeah, I think we have to be really cautious at this point in terms of claims. I think it's fair to say that there is strong potential for exogenous ketones, and even ketogenic diets for that matter, in the space of cognition or cognitive dysfunction. I think from the perspective of heart failure, I think there's emerging evidence to suggest that from a cardiovascular standpoint, there's very few downsides and the potential benefits far outweigh any risk of consuming those ketones. And then I think from the perspective of glucose metabolism, in metabolism in general, I think the potential there is very, very powerful from the standpoint of insulin sensitivity, diabetes, metabolic regulation of glucose. I think the potential is really there. I think we have to do the important clinical trials to really get at, how it's happening, why it's happening, the power that they have. But I think it's fair to, from a cognitive perspective, from a cardiovascular perspective, as well as in particular with the insulin sensitivity portion of this, I feel really good about that. And then the inflammatory cascade, like I've mentioned earlier, there's so much potential there. We haven't even begun to touch the surface of what, I mean, whether it's viral or, you think about skin conditions, for example, that people may have, I'm at a loss right now for some of the, you think about some of the, the skin conditions that people like psoriasis,
Eczema,
for example.
yes, or
Yeah, exact eczema, yeah, exactly, or psoriasis. Those are studies that, in my opinion, need to be done because I think there's strong potential there. I haven't seen a whole lot of marketing in that area at this point, so it really doesn't get at your question, but it's an area that I'd add that there's potential use in skin conditions like psoriasis because of the anti-inflammatory effects. And again, this is theoretical, but that same inflammasome, the NLRP3 inflammasome, is heavily engaged in some of these skin-related inflammatory conditions. So by and large, I think, a lot of the marketing that's happening right now, I think is fair and legitimate. And I think the one area that I'd be cautious for viewers to really think about is in the area of sport or exercise performance. I think that's the one that I've seen the least amount of data that I feel good about. Yes, it can really work. I really want it to work from a number of things, but the data is just not there at this point to support it. So I think that's the one area that I see marketing happening, to answer your question, that I'd be cautious about.
cool. So, Dr. Plaisance, thank you so much for joining us today. So, if people want to follow your work, where can they go to stay up to date?
Absolutely. So part of the work can be found at pubmed.gov. If you go to that website, you can look for our work. It's most of it's been published. It's mostly available from a public perspective there. You can find it there. You can also Google my name, Eric Plaisance, and you can find much of that work found within, and I should mention Google, I guess I should say, other, internet platforms that you can access to view there. But I think primarily in PubMed would be the place to find this work.
Excellent. Yes, and they are open access because
They are
Ingredients.
open access, and so
Yeah,
most of them can be viewed. I'm happy to provide for those that can't access those. I'm happy to provide those publications. Many of them you can find on the web as well, but most of them are going to be open access if you're wanting to read those publications.
excellent. Thank you. So, Dr. Plaisance, thank you so much for joining us today.
Thank you very much, Richard, for having me. It's been a real pleasure, and I appreciate the opportunity to join your program.
Thank you.